All right. So, hello, everyone. So glad to have you here for a really cool discussion on a topic that I think pretty much everyone can relate to on some level, headaches across the board. We'll be spending some time talking about migraines specifically, but also just all the different types of headaches that people have. And I know that, everyone pretty much has had a headache. Some people have ongoing chronic headaches, which is terrible. But we're going to talk through that today and give you all kinds of knowledge from a functional medicine perspective. And I'm excited to have Dr. Ash May join me today, who is an incredible functional naturopathic physician here at Vytal Health. Many, many years of experience across the board in all topics of functional medicine, but particularly really great at hormones, both men and women's hormones, um, you know, doing all kinds of great stuff with health optimization. But yeah, this is one of those topics that I think Ash is really, really awesome at. So I'm really excited to have you here, Dr. Ash May. Welcome.
Great to be here. Thanks.
So one of the cool things I have to say about Dr. May is that he, over the last few years, has been traveling with his family, which is amazing, doing all kinds of really cool stuff, teaching his four sons,
Mhm.
all about this incredible country of ours with a hands-on experience. So their classroom has been our country over the last couple of years, and I find that to be truly amazing. I wish I could be one of your kids, frankly. Um, Also, I really don't think I could possibly even remotely do that with my own kids. Like, I'm not sure who would be more upset by that option, my kids or me.
Yeah, I'm
But
sure all of my kids would trade spots with you.
all right, well, I'll take a spot. Because what a cool experience that you've offered your children, to be able to do that. And obviously that highlights the ability to practice,
Mhm.
telemedicine from anywhere for patients and physicians. It's awesome. But
Yeah.
anyway, so I just wanted to throw that out there because I think that's so super cool. Um, all right, so let's start by talking a little bit about headaches in general. Help us understand the different types of headaches and how, how do we arrive at what kind of headache we're dealing with?
Yeah, that's a great question because I get this a lot. People tend to, if they have a mild pain, they'll call it a headache. And then as that intensifies, they'll switch that to call it a migraine. And so I think part of the issue here is just, try to figure out how do we classify these things and categorize them just to help us
Mhm.
understand what's going on better.
Yeah. So what are
So
some of the things that you look for? Like how do you when you're talking to patients, how do you help break that down?
yeah, so there's two main categories, like big overlying categories.
Mhm.
There's primary headaches and secondary headaches. So I'll start actually with the secondary headaches because those are kind of easier to explain.
Mhm.
They're secondary to something else going on. So
Mhm.
if you have high blood pressure, you've had a concussion or a sinus infection or a cold, there's some other process that's causing that headache.
Mhm.
So if that's the case, we want to be able to figure that out because that's going to be the root cause.
Right.
And with functional medicine, that's all about what we're doing. We're trying to figure out what that root cause is, so we better understand what to do about it.
Mhm.
So there's the secondary headaches, and then there's the primary headaches. Primary headaches are basically headaches that exist that aren't caused by something else. They're just a headache,
Mhm.
and those are typically what we're going to kind of dive into today,
Right.
and not go into the secondary headache stuff
Mhm.
because again, that's going to be dependent upon whatever secondary processes that's
Yeah,
going on.
makes total sense. So when
Yeah.
you talk about primary headaches, what sort of how do you sort that out?
Yeah, so about 90+% of secondary or primary headaches are basically three categories. One's tension headaches, migraine headaches, and cluster headaches.
Mhm. Okay.
And the majority of those three are typically tension headaches and migraine headaches. So that's usually what we ended up talking about most.
Yeah. So how do you tell the difference when you're a patient and you're trying to figure out like is this a tension headache or is this a migraine or is this a cluster headache? Like how do you figure that out?
Yeah, so they do have typical symptoms.
Hmm.
So a tension headache typically is, symptoms are going to be bilateral, so both sides of the head. It's not pulsatile, which I'll go into when I talk about the migraine stuff. It's generally more dull and band-like. So they'll say like,
Hmm.
I feel like a vice is like squeezing down on my head, or they may have neck pain as well.
Hmm.
Um, these typically, they'll occur for hours, sometimes in rare cases days, but usually they're pretty short-lived. And they're called featureless, which means that they don't usually involve nausea, vomiting, visual changes, auras. They're not aggravated by physical activity, and they typically don't have a lot of photophobia, like sensitivity to light,
Yep.
or photophobia, sensitivity to sounds.
Mm-hmm.
They can, but usually they're less intense.
Yeah.
Yeah.
Yeah. So
Migraines
yeah, let's
are
talk about
much
that.
more, yeah, much more involved.
Yeah.
They actually have their own phases to them as well,
Mm-hmm.
and um, so they're going to be, as far as symptoms go, those are going to be quite different. They are going to be pulsatile, which can mean that they have this kind of pulsating kind of
Mm-hmm.
effect to them. They are increased usually if you're physically active, or if you cough, or any increased activity there.
Mm-hmm.
And they have phases to themselves too. There's a premonitory phase, which is actually happens before your headache comes on. So this is where you start getting irritable. You may have food cravings, stiffening of your neck muscles, even yawning has been associated with this
Oh, really?
premonitory
I
phase.
did
Yeah,
not know that.
yeah, and it's interesting. And so these are things that start happening hours to even like 3 days before your headache even comes on.
Mm-hmm.
So this is where, like, when we're talking to patients, like, if they can give you insight to sort of symptoms prior to their headaches, what
Mm-hmm.
kind of foods they were eating, things like that, it helps us determine, like, is this a migraine headache? Is it more tension? And what
Mm-hmm.
to do about it. So
Yeah.
that's phase one.
Okay.
Phase two is the aura phase, and this is where they'll get the visual changes. That's the most common aura, is where you start getting blurred vision, floaters, kind of line or specks in your vision.
Mm-hmm.
There are other types of auras, tingling on one side of the body. That's a sensory aura. Language aura, just where they have trouble talking or speaking, or sometimes even, like, this is where sometimes patients will they'll say, like, yeah, I just can't find that word sometimes. Like, sometimes that can be part of this language aura. And you've got a motor aura as well, where you can have weakness on one side of the body.
Mm-hmm.
And that was, those can be
That's scary. Yeah.
yeah, a little
So
scary.
many people think they're having strokes, right?
Absolutely.
Yeah. Yeah.
Absolutely. Um, and then there's the third phase, which is actually the headache phase, and this
Mm-hmm.
is where they get the symptoms of the pain. Usually, it's unilateral on one side. It can be both sides, but typically it's more one-sided. This is where they're going to get the pulsatile pain, nausea, vomiting, sensitivity to light and sound. Sometimes skin sensitivity. That's what I get when I get a migraine. My skin gets, like, super, super sensitive, like to clothing or
No
anything.
kidding.
Yeah, yeah.
Weird.
That's when I know I'm having a
Oh,
migraine.
wow.
Yeah,
Yeah. That's
because some
totally
people,
normal.
they can have migraines that aren't typical, like where their head is just kind of pounding. Sometimes
Mm-hmm.
they just get the nausea,
Mm-hmm.
or they get the skin sensitivity, and they don't have that sort of typical presentation.
Yeah, I've heard people getting like just the visual symptoms and no headache, or just dizziness, like what we call
Right.
vestibular migraines, which are
Mhm.
kind of inner ear mechanism problems, and people get dizzy or have vertigo.
Right.
And they sometimes don't even get the headache, but it's clearly like that kind of a pattern.
Yeah. Yeah.
Yeah, totally
Absolutely.
unsettling.
I know, and that's the confusing part, because
Yeah.
you get all these weird symptoms, and it's, your mind, or if you get on Google, like, it automatically
Yes.
goes to sort of the worst thing,
Call
right? So,
911, right?
yeah,
I
absolutely.
mean, yeah, it can be really scary for people. Hmm.
Absolutely. Absolutely. And then there's the fourth phase, which is the post-stromal, and this is
Hmm.
just kind of residual effects from the headache. They can last for another day or two
Hmm.
after that. And this is just where the headache's a little bit more mild, and until you do some activity or you cough, and they're like, oh, yep, that's still there,
Interesting.
and you can feel just a little off still, like just
Yeah.
not like back to normal.
Wow. Totally unpleasant.
Yeah, not fun.
I don't know how people deal with this stuff. So what's the difference between a migraine and a cluster headache?
Yeah.
What is a
So
cluster headache?
cluster headaches, yeah, that's the third category. Those are those are usually less common.
Hmm.
Presentation can sometimes be similar, so they get that it's more unilateral, but these tend to come on really suddenly, so they don't have that sort of gradual working up into the headache. They'll be really sharp and stabbing,
Hmm.
typically like in the temple area or in the eye area. and they're really intense. And then they're pretty short usually, a few minutes to maybe a couple hours, but
Yeah.
they tend to come in clusters like that. So you might have one that lasts you 15 minutes, but then you may have 3 or 4 of those a day,
Wow.
for a few days or weeks, or so they'll tend to have more of that kind of pattern, clustered pattern, but they can be over weeks to months. Uh,
Wow.
and those can be really, really intense. They can involve. We think that it's part of the brain called the hypothalamus that controls part of this, or is affected by this. So you can get symptoms that correlate with that. So you can get things like drooping of your eyelids, constriction of your pupils, um, bloodshot eyes, tearing up, runny nose, even some what's called periorbital swelling, which is swelling around the eyes, and facial sweating. So this can be really, really intense and kind of cause that almost fight or flight type of picture,
Yeah.
because it's major stress on your body too.
Yeah, especially when you're talking about the hypothalamus, which is the master gland, right? That affects the
Yeah,
pituitary, that ultimately dictates basically every hormone in the body.
right.
Can be quite a cascade of events that happen with that.
Yeah.
From what I understand, cluster headaches are more common in men. Is that
Mhm.
true? And
Yeah,
maybe
it is.
migraines are more common in women. I don't even know if that's true anymore.
It
Yeah.
is. I think it's somewhere like a third of women experience migraine headaches,
Mhm.
and it's like 10 to 12% of men. And I think the cluster headaches are less common, but they are, yeah, a little bit higher in men.
Yeah.
I don't know if we really understand why that is.
Yeah, I was going to say, do we understand why that would be? I don't know
Yeah,
that I know that
I don't
even.
know. I
Yeah.
mean, the migraine part makes sense because there can be some hormonal involvement there
Yeah.
too. So like, PMS in women or perimenopause type stuff where you've got these fluctuations in hormones that can
Yeah.
be that trigger, especially estrogen.
Right.
A drop in estrogen, with PMS, typically like right before you start your period or during your
Mhm.
period, can be a trigger.
Yeah.
This also explains some of the vasomotor symptoms we get when women get into perimenopause or
Yeah.
menopause. They get
Sweating
the
and feeling
drop in
hot. Yeah.
estrogen.
Hmm.
Yeah.
Yeah. Yeah. Yeah. Men don't have to deal with
Yeah, thankfully.
it. But you get the cluster headaches.
That's right. That's right. Yeah.
Totally fair.
Yeah. I
So,
don't think it's a fair trade-off, but
yeah, well, we would hope that nobody has to do with any of this, right?
right.
So
Yeah.
what other than hormones, which I think a lot of, I mean, when I think about my practice and the women who I see in my practice who have hormone related migraines, it's a lot of women have a hormone trigger, where
Mhm.
they notice that at certain times of their month, a headache is almost inevitable,
That's
whether
right.
it's just before their period or maybe even sometimes mid-month when the estrogen drops after ovulation, they experience headaches. But what are some of the other triggers or things that we understand now, maybe we don't understand about why this stuff happens?
Yeah, I feel like most of those are environmental related.
Yeah.
So it's the food we eat,
Hmm.
things like histamine foods, or foods that are high in tyramine, and we can go into that too. But
Yeah.
I feel like there are a lot of just like food sensitivities in general, and there's still a lot about the sensitivities versus allergies that
Yeah.
we're still learning and figuring out. But there can definitely be some environmental triggers like that.
Yeah.
Odors or certain smells. Sensitivities to light or sound, or
Mhm.
any of those, that those can be pretty huge too.
Yeah. I think there's also is there a family link as well? Like it
Yeah,
tends to run in
yeah,
families. Do we know it? So that implies that there must be some sort of genetic thing going on, right? Do we know anything about the genetics there at all?
yeah. It's the one I've seen kind of play out a lot is the tyramine.
Yeah.
So tyramine is a breakdown of tyrosine. It's an amino
Mhm.
acid. It uses an enzyme called monoamine oxidase.
Mhm.
So this is an enzyme. This is where like the sort of the old antidepressants, the MAO inhibitors, worked
Yeah.
on that, kind of inhibited that enzyme.
Hmm.
Well, we know that some people have these genetic variations that kind of mimic the effect of those old antidepressants.
Yep.
They inhibit the breakdown of that enzyme. And so that makes it kind of tricky, and could make you more sensitive to these foods that are high in tyramine for that
Right.
reason. And
So what
so
are those foods? Like, because
yeah,
this is so fascinating because it's like I feel like there's pieces of information that are coming together for me like for the first time and like, oh, that's the aged cheese thing.
Yeah,
Okay,
absolutely.
so say more. Like, what are the foods? Because I'm like, oh yeah, MAO and mono MEC. That
Yeah,
totally makes sense. That's the problem, right?
yeah, yeah, absolutely. This
Wow.
is a lot of foods that we all typically eat. So they're
Yeah.
like aged cheeses, cured meats,
Mhm.
pickled or fermented foods,
Mm.
even citrus and tropical fruits,
Ugh,
alcohol. I mean, these are all foods that most of us, in some respect, partake of a lot.
yeah. We wish we could have tropical fruits right now.
Yeah, and those are the worst. Like, all right, so if I'm putting someone on sort of a migraine protocol and we're like working through some of these possible environmental triggers,
Yeah.
when we get to the tyramine foods, people hate this
Oh,
because
I know. Parmesan.
yeah, I know it's taking
Oh,
out a lot of great foods to
hmm.
see if their headaches or their migraines get better.
Yeah. It's so true, though. It really makes a huge difference.
Yeah.
Or even just a moderate difference can mean can mean everything
Sure.
because when these are
Yeah.
really debilitating headaches.
That's the
So
hard part too, because these environmental triggers, it could be a little bit of this, like a little bit of food sensitivities. It could be a little bit of the light sensitivity. It could be it could be multiple things combined together that are triggering this. So it's
yeah,
sometimes difficult to kind of parcel those things out over time.
and it makes so much sense that it would go through that MAO channel. That is like for me. I
Yeah.
don't know why I didn't put that together in my head, but that's see, I walk away from these conversations every single time, like, oh yeah, makes
Right.
total sense.
Mhm.
So talk about histamine because you mentioned that briefly, but maybe because I think what I'm seeing a lot, and you're probably seeing this too, is just a lot of people with histamine problems,
Yeah.
and what and how that looks, and kind of maybe we maybe just a little bit on how do patients recognize whether they have histamine issues, and if they do,
Yeah.
generally speaking, how do you manage that?
Yeah. So histamine I found it kind of like the tyramine. It can be a really big part of this.
Yeah,
And people tend to be, I find, like just more sensitive to histamine type foods. So again, these are a lot of the foods that we like to eat, alcohol and fermented foods, dried fruits,
yeah.
even like smoked meats, shellfish, things like that. So
Hmm.
it's quite a bit of foods.
Yeah,
um, and I kind of like the tyramine aspect. There are people who can't break down histamine very
yeah,
well,
yeah,
and so this is like the DAO enzyme,
exactly.
part. So
Hmm.
this is where, like, as we're learning more about genetics and epigenetics and
Yeah,
gene expression and all that kind of stuff, knowing what your genes are just kind of give you some insight into, hey, could I potentially have this problem with histamine or tyramine or any of these
yeah,
other sort of, methylation, all the other sort of issues they
yes,
could present. Just
yes.
knowing that knowledge helps, sometimes, figure these things out.
Yeah, because perhaps in any of those situations, you're looking at a problem that's manifesting as headaches, but it's also doing other things in your body, right? It may be causing fatigue, it may be causing hormonal imbalances, it may be affecting your gut, you may
Hmm.
be having depression or anxiety as a result of it, or even just things that are happening in your body that you maybe don't even have symptoms of that are long-term problems with methylation and risks for developing cardiovascular disease or other types of issues that are just brewing in the background if you don't know about them. Then
Right.
you know
Yeah.
and there's such easy fixes, right? I mean, simple changes in supplements or foods and things like that. It's not a
Yeah.
major overhaul.
Right.
Yeah,
Right. I tell people this all the time. Like, we're just getting your genetics. We're not going to treat your genetics, right? It's
right.
just giving
Change
us
your genes.
information, right? And
Hmm.
how to help interpret what's going on in your life. What kind of symptoms are you having? What kind of
Yeah,
issues are you having? And that just gives us insight as to maybe what's going on at a deeper
right.
level. But we're never
Yeah,
just going to take like a SNP or some kind of gene variation and go, oh, well, you've got this MTHFR, mutation. So we're going to treat you by giving you tons of methylfolate and all these other
yeah.
things. It's like that doesn't work out. I've made
No.
that mistake, earlier
Yeah,
in
that's what
my
we used to do,
practice, and
right? Just pummel
yeah,
people with huge amounts of methylated folic acid and
yeah,
boom,
yeah. And
yeah,
then they
not
get
anymore.
anxious or depressed or
Yes,
suicidal. I mean, there
totally.
can be some major consequences to doing that.
Yes. Yeah. I love the idea of really taking the functional medicine. Well, I love the idea of taking functional medicine approach to anything, but when it comes to migraines, because there's so much there, I think that, when I look at the traditional medical approach that I learned when I was training and kind of how I practiced all those years, it was really just like this really dumbed down version of like, oh, there's only one mechanism that we
Yeah.
have that causes this problem. And so if we just target that, or we just target that molecule, or we target that issue, we're going to
Yeah.
solve the problem. And I just remember so many years of my career thinking like, we have all these medications, they're all in the same category
Hmm.
and they all treat the problem exactly the same. It's just this one's called this and this one's called that.
Yeah.
And it was and half the time it didn't work. And then we were like, you know,
Right. Yeah.
it didn't solve the problem. And now understanding the functional medicine approach and like, oh, it could be histamine, it could be tyramine, it could be food intolerances, it could be all kinds of things.
Yeah.
Um, it totally I mean the world has changed with respect to managing this issue,
Absolutely.
these issues.
100%. Like
Yeah,
it's no longer NSAIDs or triptans. Like
totally.
we've got more tools in our toolbox now
Yes,
than
yes.
just those things. Yeah.
Yeah, absolutely. So talk a little bit about like what kind of testing would you look at? Let's take two categories. One is the person who you're trying to figure out what kind of headache they have.
Mhm.
You know, is this a migraine? Is this a tension headache? Is this some, is it, what is it? And then the other side is we know you have X, you know, we know you have migraines, you've been diagnosed with migraines. How do we, what are some of the tests that we might deploy there?
Yeah. So when it comes to the headache part, I think the first thing is really determining, is this a primary or secondary headache?
Right.
Is this coming on all of a sudden, or is it progressive? Is it not responding to various treatments?
Mm-hmm.
If seems more serious, then that's when, a more thorough workup needs to be done,
Yeah.
some brain imaging and things like that.
Right.
But once we kind of figure out, okay, this is a migraine, let's start working through like what are some of the potential causes. And so that could include things like testing for food sensitivities.
Mm-hmm.
And
Yep.
so this is like an IgA sort of,
Mm-hmm.
testing where we're just looking at a lot of different foods and how your immune system's reacting to those
Yeah.
foods and seeing if anything, significant pops up. That's a great first step to sort of think, all right, how are we going to modify your diet? That's a really good first step of saying, all right, we know that your immune system's reacting to these foods like this. Let's just take them out for a while and see if your migraines get better, less
Yeah.
frequent, less intense, all of those sorts
Mm-hmm.
of things. And then we can start working your way as far as the food into other sort of categories. And this is where the histamine and the tyramine,
Yep.
foods come in.
Yep.
So that's a great start. If
Yeah.
you're a woman and your hormones or your migraines tend to be somewhat based around your cycle, or maybe you're in your 40s, early 50s, you're in sort of that perimenopausal
Mm-hmm.
phase of your life, and your hormones are starting to go down. This is
Mm-hmm.
a great time to get some hormone testing, and let's see
Yeah.
what the hormones are doing.
Yeah.
Um, and that's kind of where I first start there, because that's a not necessarily an easy fix, but that's a fix that we can get to pretty
Yeah.
quickly, it seems, and get you some relief.
Yes. Makes total sense. Um, I think one of the things that I've always thought about in terms of triggers is one of the biggest ones we always talk about is stress.
Yeah.
And in that way, what I've thought about when I think about headaches is that I'm thinking now more along a continuum of tension headaches and migraines, and let's kind of even put cluster headaches in there as being on a continuum, because just because you're a patient that has migraine headaches doesn't mean that you sometimes have tension headaches.
Right.
You know, and sometimes people who have tension headaches can go on to have more severe headaches, and they're probably on a continuum as opposed to like two separate buckets.
Absolutely.
And stress, obviously, is a huge trigger for musculoskeletal headaches, right? The shoulders are up, and you've got all this muscle tension. People sitting at computers all day, feeling a lot of sort of musculoskeletal tension in their upper bodies and their head. Um, Stress being what it is in this day and age. So, are there any tests specific to looking at stress or managing stress from I guess, from a functional medicine standpoint that you would think
Yeah.
about?
Absolutely. So
Yeah.
there are stress hormones, so
Yeah.
if you have a lot of stress, we can test those stress hormones like cortisol and
Hmm.
see what's going on there. Like
Yep.
maybe you're having this really intense, stress reaction, and we can see where that level is throughout the day with your cortisol, because we're doing multiple measurements through the day,
Hmm.
and we can see what your stress hormones are doing. And if you're saying like, I get these headaches typically in the afternoon, and we're seeing a little spike in your cortisol, then That's
There
a
you
pretty
go.
good correlation there. Yeah,
Yeah.
that we can say,
Yeah.
all right,
Makes
this
total
might be
sense.
due more to stress. Um,
Hmm.
or maybe you're just overall your hormones are those stress hormones are high,
Yeah.
and we need to just work on different ways of
Mhm.
reducing stress. Because I mean, we live in a stressful environment. We
Yeah.
just there's no change in that necessarily, but we can change the way that our bodies react to stress, and
Yes.
that's where things like meditation, prayer, and deep breathing exercises and
Hmm.
all those sorts of things
Yeah.
really come into play.
Mindfulness. Yeah.
Yeah, yeah,
Self-talk, all that stuff. And just
absolutely.
moving around. I mean, I think, I was just talking to somebody this morning about how, we spend so much time sitting in front of computers.
Mhm,
And, that's obviously the way we see patients and things like that. But just to be able to get up and move around
mhm.
makes a huge difference, right? Not just sitting in one position all day. And
Absolutely.
um,
You have to break up that, that sedentary sort of lifestyle. So,
mhm.
this is something I've had to adjust to, just going more telemedicine the last few
Yeah,
years.
yeah.
And like, so, sometimes it's just a matter of like, you have 5 minutes between patients, you get up and you do a few
Shoulder
squats,
rolls,
push-ups. Absolutely. You stretch out a little bit, you do
Helps.
something to kind of break up that behavior a bit.
Yes.
Because as we sit, everything changes,
Right.
right? It's like sitting is not an ergonomic position no matter what you do. So,
Totally.
inevitably over time, your head's going to jet forward, your shoulders are going to roll forward. Like
Mhm.
that's why our neck muscles tend to be stressed most
Yeah.
because our posture changes and moves forward. And
Yes.
so you're really stressing those neck and upper back muscles when you
Yes.
do that. So sometimes just getting up and breaking that up and
Yeah.
stretching and engaging those muscles, really helps break
Yeah.
that cycle of just sitting.
It's huge.
Yeah.
It's huge. Yeah, that's been a big thing for me, with neck issues and things, to just be able to move around and, do the range of motion and that kind of stuff makes a huge
Yeah.
difference.
Yeah, a little bit. So, too, with when it comes to exercise, people think that they have to carve out 30 minutes or an hour
Yeah,
per
exactly.
day to get in their exercise. Like, no, if you have 5 minutes, but you have 5 minutes, you know, 20 times a day that you could actually do a little bit of
It
exercise, that
works.
really adds up
It
over
does.
time.
Yeah,
So,
just do a couple laps or around your house or go up the stairs, or just something simple like that can
yeah,
make all the difference in the world.
yeah,
Right,
yeah.
and really loosening up the upper body and the neck,
Mhm.
with that same kind of action, I think makes a huge difference.
Yeah. I mean, there's this study came out a few years ago. It was eye opening to me, but it said regardless of physical activity, if you set for 6 or more hours per day, you had a 40% increase in all cause mortality over the next 15 years,
Amazing,
which is
right?
just a shocker. Yeah.
Yeah, I think the
And
headline
so,
was, "Sitting is the new smoking," or something like that, right?
yeah,
Yeah,
absolutely.
yeah.
Yeah. So it's like
Mhm.
just the act of sitting for long periods of time is, yeah, it's a major risk factor.
Yeah,
So you have to
yeah,
do anything you can to break that up.
totally. Yeah. So, what are some of the other treatments? We've talked a little bit about food elimination, some of the big common ones, the tyramine containing foods, the histamine containing foods, and then foods guided by your particular personal food sensitivity panel. What are
Yeah.
some of the other treatments that we put into place for patients who have, let's talk about migraines, because I think that's kind of the most common headache.
Yeah. So this, I found this can be pretty diverse, and so
Hmm.
sometimes this is a matter of trying a few different things to see kind of what fits you best. But
Yeah.
this can range from things like vitamin B2, which is riboflavin,
Yep.
magnesium, especially different forms of magnesium. So if
Say
this
more
is
about
more
that.
of a tension headache, you may respond better to like magnesium malate or glycinate.
Hmm.
If this is more of a migraine, I've found that people respond better to magnesium L-threonate, which is the
Hmm.
only form that actually gets through the
Yep.
blood brain barrier and into your brain.
Hmm.
So sometimes it's just a matter of finding the right form of magnesium too. CoQ10, as far as herbs go, butterbur has been one that's been around for a long time. This is pedicides.
Yes.
We know that it's very anti-inflammatory and antispasmodic,
Hmm.
so it works pretty well with tension headaches and sometimes with migraines as well.
Does work really well. Yeah, it's amazing.
Melatonin is another one. I think this has to do with just our um, we have electricity now. We can stay up to all hours of the night. Our circadian rhythm issues are increasing. Living in
Epidemic.
Alaska, for years, like this is a huge one because
Yeah,
you
true.
can't you can't get your environmental triggers from the sun because you would be hibernating all winter if you did that. So,
I don't know how you lived there all those years.
I know. So it's like we have to kind of input in our life ways of like regulating our circadian rhythm.
Hmm.
It's just like using a full spectrum light in the morning time sort of thing to kind of mimic that sunrise.
Yep.
And then using things like melatonin at nighttime to help kind of set that nighttime routine. So I think part of this could be just the sleep disturbance that happens. It could be that trigger
Yeah.
for migraines to happen.
Yep.
And if we can get melatonin in, maybe that helps to regulate your circadian rhythm better, improve your sleep quality, and that can affect your migraine frequency and intensity.
Yeah. What kind of dose of melatonin do you typically start patients on? I get that.
I start really conservatively,
Yeah.
1 to 3 milligrams.
Yeah. Right.
The trick with that one though is I feel like with just regular melatonin, it gets metabolized really quickly. So
Yeah.
I'll add a slow release
It's
in
the
there
sustained
as
release
well
version. Yeah.
sometimes. Yeah.
Yeah. Makes a huge
So
difference.
having that quick release and the slow release combined sometimes really helps.
Yeah, there's such subtleties with melatonin. I think people go like, "Oh, I tried that and it didn't work." They went
Yeah.
to the pharmacy and
Yeah.
bought something, and it really is dose dependent. And the type of melatonin, sustained release versus rapid acting,
Yep.
sometimes that is that's the ticket.
Yeah, absolutely.
Yeah.
And the other thing too is not to get into a lot of dosing stuff, but
Mhm.
melatonin doesn't have a negative feedback loop like other hormones do.
Mhm.
So, like if we were to give you testosterone, it would shut down too much testosterone. It would shut down your own body's production of
Right.
testosterone. The pineal gland, which produces melatonin, doesn't have that sort of negative
Yeah.
feedback.
Amazing.
So we can actually be aggressive with melatonin and
Yes.
start really ramping it up to see,
Mhm.
some people respond well at 3 milligrams, some people need 12 milligrams, some people
Yeah.
need 20. Like it
Yep.
can be pretty diverse.
Yes.
So
Exactly. Yeah.
working with your provider to kind of figure
Mhm.
out what that dose looks like for you can
Yeah.
can be really helpful.
Yeah. Makes total sense. Do you use any L-arginine at all in your migraine management? I've
Yeah,
had some luck with that. Yeah,
yeah.
talk about that a little bit.
Yeah, so L-arginine is great. It's part of that sort of nitric oxide cycle, and like
Hmm.
this can I found be helpful in people who have some cardiovascular disease or cardiovascular issues
Yeah. Yep.
that could use more nitric oxide and better blood flow and
Yep.
things like that.
Yep.
And so this is where I usually see men in their late 40s, early 50s, where they're really starting to have more cardiovascular symptoms, higher blood
Mhm.
pressure, things like this. And this is
Mhm.
where again that secondary type of cause for headaches can come in.
Yes.
If you
Yes.
have blood pressure, which we call the silent killer, right? Because
Absolutely.
people can have moderate to elevated blood pressure for decades
Yeah.
that is contributing to their cardiovascular disease that they're not even aware of.
Oh, and maybe
And
they're just chalking that headache up to,
yep,
something else, and meanwhile their blood pressure is high, right?
right.
Yeah.
So
Yeah.
honestly, the two things I tell guys when you start getting into your 40s to start looking for are headaches and erectile dysfunction,
Yep.
because those are
Both
two
strong
big
indicators.
keys, indicators that could be
Mhm.
telling you you're starting to develop cardiovascular disease at a
Mhm.
really, early. Those are going to be early signs
Yeah.
that
Yeah.
develop. So
Yeah, that's so true. What other modalities do you, so we talk a little bit about some of the herbal approaches, and then the other thing I would say is the magnesium thing you said was totally spot on. I mean, magnesium has been a great approach, and I think some of these subtleties to what type of magnesium you use. This tends to
yep,
be another thing that people go and try. They read about it and they go out and try it, and they purchase, magnesium citrate or magnesium oxide, which are very
yep,
hard on people's guts, and then they abandon it because, oh, I had, diarrhea from it. Well,
right,
using
yeah,
different types of magnesium can totally mitigate that problem and
absolutely,
go a long way to help the migraines. And the riboflavin thing too. I mean, there's pretty good evidence behind riboflavin, but not at the doses that you would typically get in like a
no,
multiple vitamin where it's
yep,
going to be, 20 milligrams. You need like 300 milligrams of riboflavin, right? You need a higher
yeah,
dose of
sure.
it to do the good job that would help the migraine.
Yep. And that's part of, when we do an intake, we want to know like, hey, what have you tried for this so far?
Right.
And that's exactly the conversation patients often have is, oh yeah, I tried riboflavin,
Yeah, it didn't
I
work.
tried this and that,
Yeah.
magnesium and all that. And then we have to like prod, even further. Okay, well,
Mhm.
what form did you take? How much did you take? And usually it's almost 100% of the time, they didn't have the right dose or they didn't have the right
Yep.
form of the
Hmm.
nutrient.
Yep.
So we
Yeah.
could still include that. Yeah.
And that they don't know that they maybe need even more than the average person because of genomics or because of absorption problems, or you name it. There's so much variation from person to person. um,
Right.
Working with that and getting that right, I think, is one of the really great things that functional medicine offers, is the ability to personalize that a lot.
Absolutely.
What are the other modalities that you typically recommend? We talked about exercise and movement, but what are some of the other things that you help, in the lifestyle category, or even sort of the body work category, things that are
Yeah.
helpful?
Yeah. So if this is tension related and even migraine, related,
Mhm.
then sometimes some acupressure, points.
Mhm.
You can do a lot of these yourself,
Mhm.
especially as you start to feel a headache come on, whether it's tension or migraine. And so I'm not an acupuncturist, but there are certain points that they figured out a long time ago that
Yeah.
work, you know, and I don't know how it works, but it often does work really, really well.
It
Uh,
does.
yeah, so I go through a few different points with
Mhm.
patients, tell them to try it. If it works, great. That's an easy fix for
Yeah.
you. But the sooner you start it, the sooner you implement it, the more likely it is to help, especially if it
Yeah.
is related. So
Totally.
I have them do like the third eye point right there, and
Really
then
important one.
yeah, that's a
Yep.
that's a really strong one. And
Yeah.
then the inside of the eyes,
Mhm.
there, just a light massage, just a circular massage, just like that.
Yep.
Right above the ears is another one
Mhm.
that's good. You can also move to the temple area as
Yeah.
well. And then the one is, I think it's called Hiju. I may be getting that wrong for your acupuncturists out there. I'm sorry,
I
Chinese
actually
medicine.
trained in acupuncture, but I don't know the Chinese names of the
Yeah,
points.
yeah, my Texas tongue too kind of gets in the way of pronouncing those sometimes too. So, but that's the one that's right there in
Ah,
between
yeah. Yeah.
your thumb and your index
Yep.
finger.
Yep.
That one's a huge one. I think that
Yes.
was probably the one that works probably the
I think
most.
that's large intestine, if I'm not mistaken. I think that's large intestine 3.
Yeah. Okay.
I'm
I know.
really getting far back on that one, but yeah,
Yeah.
you're right.
So
That is helpful.
those are great starting points. Just kind of feeling around your neck and find where those sensitivities are and work on that. So if you have like your sternocleidomastoid muscle
Yep.
here, which
Mhm.
is another common one because it attaches at your skull, you can
Totally.
find little trigger points there and just massage those
Yes.
or put pressure on them while you just do some slow neck movements.
Hmm.
Those little things like that can really work.
Really
Because
be helpful.
tension headaches too, like we're starting to see a slight change in our thinking of what causes them. It used to be sort of a bottom up approach. You have tight muscles that's pulling on the attachments that are near the skull. So like your
Hmm.
muscles in the back of your neck, attached to your skull. So we think, well, it's because the muscles are tense here that are pulling on the skull.
Yep.
Now there's some theory that it actually might be more of a top down sort of
Oh,
an,
interesting.
where the connective tissue, there are these nociceptors, there's pain receptors, they're on the surface of the skull,
Mhm.
and in that connective tissue, they get sensitized, and then that creates more tension here and more
Ah,
pain in the neck muscles.
yeah.
So this is where like doing some
Learned another thing.
yeah, scalp massage, doing these little trigger or
Mhm.
acupressure points, maybe that can help. So
Yeah.
regardless if it's bottom up or top down, it doesn't matter. It's you still work all those little points and the
Yeah,
problem.
makes total sense. Massage, I think both for all kinds of headaches. And I also think there's a role for trigger point, whether it's trigger point work, like in this case of dry needling, or,
Yeah,
in acupuncture, it can be just, sort of using the upper body as a place to work on trigger points, or
right.
injections. Sometimes we do injections and trigger points. Those can be really
Yep,
helpful. Um,
absolutely. And
Nerve
that's where I tell people
blocks.
like start with just pressure. And
Yeah.
then
See if it
you can go to
helps.
acupuncture, and then we
Yep.
can go to like through dry needling or
Totally.
do injecting something in there, like if it's trigeminal related.
Yep.
This is where like so the Botox treatments come in.
Botox has been
Um,
so helpful. Have you seen that with your practice? Yeah,
Absolutely.
seems a
I
little
haven't done it
scary, but
myself,
man,
but
does it work. Yeah, I
yeah,
haven't had it either, but yeah, I've just
yeah,
had some patients really, really like really bad, like long-standing migraines have done really well with Botox.
yeah,
So people are
yeah,
listening, like if that sounds like medieval torture, like why in the world would you do that? It actually does, I mean, for a lot of people, significantly help.
sure,
So it's something
absolutely.
to be thinking about.
Yeah. but it's, it's a progression. Like, it's like
Yeah,
I tell people all the time, like, we're working in sort of layers here, right?
yeah,
So first
exactly.
we're going to start with some foundational first line sort of therapies. These are
Mhm.
going to be low in the interventional sort of category. So
Yeah.
they're going to be lifestyle changes,
Mhm.
dietary changes, things like that. Then we move up to more aggressive type treatment. So this is
Mhm.
more using other providers,
Mhm.
chiropractors, massage therapists, physical therapy, things like that.
Mhm.
And then we can further go into higher, more invasive sort of things like injection therapies and
Yep.
stuff like that. So it's all a process, but
Mhm.
you don't want to necessarily always jump to the higher interventional things first, which is
Yeah,
really what we kind of typically do with our conventional model now.
right.
Let's start with the foundational stuff first and work our way up.
Yeah, because you're gonna get better health out of that foundational stuff and
Absolutely.
symptom
Yeah.
relief, right? Potential resolution of the problem.
Yeah.
Let's just talk a little bit about, medications because I mean, I think that we've talked a little bit about Botox, but I think medications have come a long way too. Again,
Mhm.
not the first thing we want to reach for necessarily, but they're in the toolkit, and so we definitely want to think about what are some of the approaches that we can take from a prescription standpoint if we need to.
Yeah.
Any thoughts on that?
Yeah, I mean, triptans are still, a big part of this.
Hmm.
The way that they work on serotonin and constricting kind of blood vessels in the brain.
Yep.
So you things like, Imitrex and Maxalt,
Mhm.
those are still a big part of,
Yep.
migraine.
And
You
they
know,
work for a lot of people.
absolutely,
Yeah.
100%. Yeah,
Yeah.
absolutely. The really unique thing too with cluster headaches is they found like using 100% oxygen,
Yeah.
and sometimes combining that with a triptan like works really, really
Huge.
well. Yeah.
Yeah. Yeah.
So,
That's amazing. Yeah. Some of the newer generation medications that have come out for migraines, this whole category, I don't even remember what the target molecule is. It's got a funky name, but really helpful. I mean, where patients can't get relief and they've really gone the extra mile to try to do everything right and they just can't get relief.
yeah,
The newer generation medications, including I think a better approach to using Botox in this way,
yeah,
have been really helpful as well. But again, we're not looking to just mask symptoms, treat symptoms. We want people to feel better because these are very miserable headaches, obviously. But working
absolutely.
on the basis, as you talked about, sort of this pyramidal approach of taking care of the root cause related stuff, because that again has a huge impact on headache patterns
Mhm.
and can also have an impact on just general health, working
Yeah.
on weight management, blood pressure management, up
Mhm.
to activity levels, treating problems in the genomic area just for longevity and good health makes
Yeah.
total sense. Yeah.
Yeah, I agree. And I'm sure this has been your experience too, but most patients that I've seen with headaches, migraines, things like that, if we go through this progression, I'd say somewhere in the 80 to 90% of them don't need to go to
Yeah.
more medications or
Yes.
Botox, things like that. That's a
Yeah.
small percentage of people that need those
I
interventions.
agree. Yeah,
If
I
we
agree.
do,
And
if we do all the work, which takes time, that's
does.
the hard part here is this,
Mhm.
you're not going to fix this in a 15-minute visit with your provider. This is going to take some time and
Why do we do that? Well, we don't, but like,
right,
how do you
right.
think you're going to fix a complex problem like this in 15 minutes?
You can't,
It's
and
just
that's
not
just it.
possible.
That's
Yeah,
yeah. All you can do is slap a band-aid on it,
absolutely.
or just continue like the polypharmacy type of approach.
Mm,
Just keep throwing things at it.
yeah.
Hopefully, kind of something sticks. I use the analogy of playing darts blindfolded. Sometimes sometimes you get lucky and you
Or
just
just
hit
playing
it.
darts in my case.
Yeah. Without
I'm
the
not so good
blindfold.
at
Yeah.
it. Wow, yeah, just
So
seeing what
yeah,
sticks,
sometimes you get
right?
lucky, but oftentimes you don't.
Yeah,
So
that's a great analogy.
yeah,
Oh my gosh. Yeah. So that is so true. And meanwhile, people are suffering and missing work and not
right.
able to participate with their families and they're in bed for 3 days straight, clutching
Yeah,
at skulls. I mean,
yeah.
it's a pretty wicked problem.
Yeah. And the other part is just educating patients to know what to expect and
Mhm.
what we're doing with them. Like, this is the progression we're going to go down. This is why this happens. So is that's why we kind of went into the categorization of headaches and things like that. Like,
Yeah.
the more they understand like what the process should be,
Mhm.
the more likely they're going to stick with it in the
Yep.
long term and work
Yes.
through all of those sort of layers of treatment.
Yeah, and get some control back, right? Because it feels like these things are happening to us.
Right.
And if we can hold some control in that space, even if we know like what to reach for and at what time,
Yeah.
or who to call in what situation, or how to manage the day if you feel like a migraine is going to happen. Like that gives so much control to people, and that helps a lot.
100%.
Yeah,
Absolutely.
yeah. Well, this has been such a fabulous conversation. I always love this because I always walk away, I'm like, oh my gosh, I learned so much just having
Yeah.
this conversation with you.
Nice.
So
Oh,
good.
this is great. No, I love it.
Thank you, Dr. Ash, the headache guru, the
Yeah.
migraine man. I
Yeah.
really
No, it was a
appreciate it.
pleasure. Always fun.
Yeah. Yeah, thank you so much. And this is something that obviously all of our practitioners deal with, but obviously this is a really important area to work with a functional medicine doctor on. And maybe in collaboration with your neurologist or your GP.
Absolutely. Yeah.
But yeah, this
100.
is a really helpful way, I think, to approach this problem. And as we said earlier, it's pretty widespread, and pretty much
Yeah.
all of us have had some experiences with this.
Yeah.
So yeah,
Yeah.
awesome. Thank you.
Absolutely.
I
It was
greatly appreciate you and everything that you do for your patients. And it's an amazing thing. It's an amazing gift to have this much knowledge, this
well,
depth of knowledge.
well, it's a great team. I love working here. So
Thank you, Ash.
great. Thank you.